Welcome everybody to this webinar about how to develop a winning communication strategy for health foods and clinical nutrition. This webinar is the first out of a series of 3 marketing webinars. For each session we invited some of our SKIM experts to share their learnings and insights with you. Today, Karin Lieshout, our Managing Director, and Benoît Gouhier, Senior Project Manager Consumer Health, will talk about what distinguishes a winning communication from a losing one.
Thank you, Margaret. So hello everybody, and thank you very much for attending our webinar today. So Karin and I are very glad to share some of our main learnings on how to communicate effectively to consumers, but also healthcare professionals. But first, let me briefly explain to you how we have built these learnings. We have reviewed more than 100 communication studies, so concepts, claims, and detailed aid studies conducted among healthcare professionals or consumers. We are talking today about medical nutrition and health foods, but please note that our learnings are actually based on a wider range of categories, covering also pharmaceutical, for instance, or FMCG products, or even durables. But before sharing our learnings, I would like to invite you to think who is your target group. Because the first step to develop a winning communication strategy is to ensure that you know well your target audience. So who are they? And even if you know who they are, let's dig somewhat deeper and ask yourself the question, do I really know what triggers them? This is what we are going to see in the first section. So on this slide, we would like to discuss an example of a possible decision-making process. So we are talking about a new medical nutrition product designed for sarcopenia here. So for those who are not familiar with this term, sarcopenia is actually the age-related muscle loss leading to the loss of mobility in elderly people. So let's assume that this new product is not reimbursed. Consumers have to pay for it and are therefore your main target. They have to be convinced. But and as you can see on this chart, good news, their interest for your product is actually very high. However, we learned from market research studies that most elderly people generally first ask to their healthcare professionals to recommend this product. So they are actually often already taking medications and want to check if this product is good, safe, and effective, and therefore worth the money. As you can observe here, only few GPs will recommend this product. This impacts drastically consumers' willingness to purchase, because we can see that eventually only 5% will buy this product. So convincing GPs is therefore key. So of course, this is just an example, and the key player will vary greatly depending on the products and indication areas. But in all cases, you need to identify each player's role and define their relative importance before even starting to develop your communication. So now moving on to next slide. Knowing your target group or who to target is not enough. You need to understand who they really are. So let's focus first on these sarcopenic consumers. Who are they? So of course, many things can be said, and you can read on this slide multiple characteristics. I will therefore focus today on one of these aspects. In our studies, we learned that the awareness of medical nutrition and of their benefits is generally very low amongst among consumers. It is therefore crucial to clearly communicate what the product actually is. Is it a food product or a medication? Does it contain active ingredients or medication? What makes it different from other products you can find in a pharmacy or even at a grocery store?
Thank you, Benoît. This is already interesting, but I think it's quite general still. I think to develop a communication message, we need to give these patients a face, so we can find out what really trigger or really worry them. So here you see their faces and their lives. So on the left side you see Jim. He's 70 years old, he lost his wife, lives in an elderly home, but he is very active. He goes out fishing, plays cards with his friends, and takes his grandchildren for a walk. Losing his strength will be losing his life. And on the right you see Lucy. Lucy suffers from diabetes, but she enjoys life with good food, a glass of wine at 5 p.m. and regular holidays with her husband, for example on a cruise ship. And these people, they have fears and they suffer from certain conditions, but they have a very positive attitude towards life, and they are motivated to search for solutions that will help them to keep on living the way they do now. And when observing them, you just know that these people will be triggered more by words like remaining active and remaining independent, and they will be far less triggered by words like treatment, disease, and avoiding muscle loss. This is very negative. But when knowing them, you also realize there are barriers that should be addressed in communication. Here, those consumers already take many medications for other conditions, and they might be worried about interaction effects of a clinical food product. To convince them, you should therefore explain what the potential effects of your product on other medications could be. Now, we have learned earlier that sarcopenic patients tend to rely on their healthcare professionals. Now, convincing healthcare professionals is therefore important to drive your product's success. So we need to understand who they are as well. Now, like Benoît, I show you here some general similarities GPs show. First of all, healthcare professionals are highly respected individuals in society, and the result is that they often have a sense of pride. And this makes it easier to offend them, and so you will have to treat them with respect. They are also highly educated people, which makes them critical towards the information that is given to them. And apart from that, they assess products on evidence-based information. They are not willing to endorse a product without any strong evidence. So you have to realize that this makes them quite suspicious to recommend medical nutrition, as they are not always supported with as many clinical trials as drugs. Also, don't assume GPs have good knowledge of clinical nutrition. They need to be informed and convinced of the level of efficacy that can be achieved, the working mechanism, or how to use medical nutrition so they can brief their patients.
So this is true, Karin, but as you mentioned before, for consumers, you need to dig deeper and understand who these healthcare professionals are and what really triggers them. So for example, on this slide, you see here like a young GP and a more experienced GP. We learned that they tend to react differently to medical information that is presented to them. So young GPs are of course less experienced, and they tend to be more insecure about their own knowledge, and they often fear to make mistakes. They are therefore more suspicious about information provided by pharma, compared to experienced GPs who are more knowledgeable and confident to balance shiny product information by their own experience. So what does this mean for your communication? Well, it means that while both will ask to see clinical evidence, young GPs are likely to be much more critical and ask more details than experienced GPs. So of course, experience is not the only difference, and many other factors play a role, such as country, where you have different reimbursement systems, and therefore where mentioning costs in your communication will be more or less relevant, but also factors like cultural differences, attitude towards innovation, or even personality. So our message here is to develop a great communication strategy, you first need to understand thoroughly consumers and healthcare professionals. Identify what triggers to focus on and which barriers you need to overcome. The alternative is just guessing upfront, which definitely lowers your probability of success. Okay, so in this first section we have learned how important it is to dig into your customers to understand who they are. Now we would like to share 6 golden rules of winning communication. So to illustrate each rule, we will use examples of messages who resonate and messages who doesn't resonate that well, and explain you why.
In order to illustrate the first golden rule, please imagine that we are communicating to GPs about a medical nutrition product designed for sarcopenia. So I would like to know from your side, which statement do you think is most powerful? Help 70+ patients maintain their muscle mass and strength, improving patients' independence and mobility. Second, help 70+ patients maintain their muscle mass and strength, leading to decreased demand on healthcare services and associated cost. Or a unique product specifically designed for a better mobility. In the next screen now, you can type in your answer. Okay, let's look at the results. Most of you say that the first statement is the most powerful in this case. Now, the results, you are quite right. The message that healthcare professionals prefer is also the first one. Because if you look at the third one, which is actually also chosen by a certain percentage of you, when evaluating these type of statements, healthcare professionals perceive these as empty commercial statements. As you can notice, it actually does not specify any benefit, while the other two do. Remember that healthcare professionals are experts with a high status and a great sense of pride. And as a result, they are not used to being told how things work or how unique they are. They consider themselves to be the ones, based on experience and evidence, who should judge whether the product is unique rather than being told so. Now, obviously, providing content like is being done in the first two statements is not enough to promise value, and you have seen that well. The benefits stated should also be relevant. And we found out that healthcare professionals value patients' benefits more than any other benefit, such as possible cost savings or benefits for themselves. So healthcare professionals are patient-focused rather than product-focused or cost-focused, and therefore claim with patient benefits resonates better. So precondition for successful communication is to promise value, and promise value by communicating relevant and tangible statements, so avoid these fluffy statements, and put the emphasis on patient benefits.
Okay, so our second golden rule actually addresses how to best position your product next to your competitors. Because when launching a new medical nutrition product, for instance, both consumers and healthcare professionals will compare your product with a set of alternatives. When it comes to medical nutrition or even health foods, we learned that both healthcare professionals and consumers actually compare them to a wide range of products. So the nutritional products, of course, but also prescription drugs or even just a healthy diet or exercising. So this varies, of course, greatly depending on the health benefits you deliver and the indication area. So as a result, you first have to understand what your product is exactly up against. Only then you can identify how to position yourself against these alternatives in order to show that they are a superior option. But how to do that properly? Well, let's see that in the next example. So once again, please imagine that you are communicating about a new product designed for sarcopenia to GPs. So this time we have two statements, so I will read them out loud. The first one is provides 30% more protein than the protein level that can be met exclusively with a healthy diet. And the second one is more effective in increasing protein level than a healthy diet. So which one do you think is more effective? Well, here we see a quite clear-cut preference for the first. All of you are right. We learned that the first statement would actually resonate better, and this for two main reasons. First of all, the second message somehow implies that the product could replace a healthy diet. A healthy diet is systematically recommended by healthcare professionals, and is the last thing basically that they want to do is to undermine its importance. So encouraging a product that could replace a healthy diet would therefore discourage patients to follow this healthy diet. So successful product will therefore clearly communicate its added value on top of a healthy diet rather than in replacement. The second reason is that you should never simply say that your product is better, but you should show that it's better. So the second statement simply states more effective without mentioning any evidence or measure of this efficacy. Healthcare professionals want to be the one making the call on what is best themselves, rather than just being told so. So our second golden rule is set yourself apart by communicating clearly the added value of your product. So to do that properly, you need to first carefully assess your competitive environment, and then explain the position of your products next to other therapies, and show that you are better rather than simply saying it.
Let's move on to the third golden rule and now use an example of messages targeted to consumers about medical nutrition designed for managing type 2 diabetes. Again, which statement do you think is most powerful? Manage your diabetes with a blend of essential nutrients, or delay the progression of diabetes with a blend of essential nutrients? Actually, your answers are quite mixed. The first one is chosen a bit more than the second one. The right answer is the second statement. It's stronger because it's more specific. If you look at the first statement, manage is very vague and unclear. Does it mean you will be able to maintain or to improve your current status? It's not clear. And in the second statement, manage is made specific. We delay the progression of diabetes. And this will present the consumer with a value promise that they can relate to, and can encourage them to use the product over alternatives. Being specific is one of the most important drivers of winning communications. Healthcare professionals and consumers like clarity. They want to know exactly what tangible benefits your product will deliver and how much or how much more than competition. So the golden rule is that communication should be specific, and this implies describing precisely what tangible benefits your product will offer to consumers and to healthcare professionals. And in our example, we show that you could be specific by using words, but using numbers, of course, are also a good way to make your message more specific.
Okay, let's move on to the fourth rule now. So please imagine that you are communicating about the role of leucine in maintaining muscle strength, and you are communicating to a healthcare professional. So the first option is leucine plays an important role in maintaining a strong body. And the second option, leucine can promote muscle anabolism. So which one do you think is best? Okay, so let's have a look at the results. We see that 83% actually think the second one is better. Let's see what we observe. Well, most of you are right. The second statement is actually the best option. Well, first, actually here the first statement uses very simplistic or more consumer language, mentioning like strong body. In addition, content-wise, it states information that is really obvious to healthcare professionals and more targeted to a consumer. It therefore may create confusion among the healthcare professional. So as a GP, for instance, is this information addressed to me, or am I supposed to share it to my patient? So we learned that actually these both mistakes, like the fact of using consumer language or providing obvious information, can really easily offend healthcare professionals. So our fourth golden rule is to be respectful in your communication. And being respectful means do not state the obvious to your target audience. Always use the adequate language, so always stick to a medical language when you talk to healthcare professionals, and never be condescending, presumptuous, or offending in any way. So this may really seem obvious to you, but we observe in our studies that it's a mistake that is very often done.
Okay, golden rule number 5. I would like you to think of a new product designed to help elderly people maintain their memory. Actually, I'm also interested. We have the two messages here to present his products. Which message, again, is most powerful? Contains amino acids and DHA to help maintain memory and is easy to use, or contains amino acids and DHA and is easy to use. You can choose again the most powerful one according to you. Okay, go to the results. And the first one, almost everybody say the first one is most powerful. And you are right. As a marketer or as a researcher, you are working on a specific disease, ingredients or products for months or even years. And you therefore have acquired a very rich and specific vocabulary around the disease and around your products. And even sometimes you created your own internal words to refer to a project or technology, which are very commonly used within your organization, but realize this is only in your organization. And it sounds very obvious. Hey, you almost all had this answer right. But we notice over and over again that when reviewing communication materials from our clients prior to testing, it is very easy to lose track on what terminology can be used when communicating to healthcare professionals or to consumers. Now, as you can see, both messages mention key ingredients of the new product. Mentioning this or using jargon can indeed be a good way to increase the credibility of a product. However, it's crucial to specify the associated benefits to make it meaningful to your audience. And this is only being done in the first statement. So the golden rule is be cautious with the use of jargon. And this is applicable for both consumers and healthcare professionals. And when you do use jargon, such as not widely known ingredients, technology or conditions, make sure that unclear terms are related to what they really mean to your audience.
Okay, well, let's move on to the last golden rule. So we are now communicating to consumers, and we are communicating about a product that is designed to help maintain muscle strength. So here again, two statements. The first one is help maintain muscle strength over time, and the second one, avoid losing muscle strength over time. So what do you think? Which one is best here? Okay, so we have a clear preference for the first one, for almost more than 3/4 of you. And indeed, this is the one that is like the better option here. Why is that? Well, most consumers will prefer it because simply for the fact that the second one sounds more negative. It basically reminds you that your body is breaking down over the years. So it's not that nice to hear. So what we've learned in our studies is that focusing too directly on the disease can sometimes cause fear or even anxiety. It can basically recall you that you are sick. So twisting the benefits so that it becomes something positive is therefore most often a better solution. So our sixth golden rule is therefore to be positive. This can be a tricky one in healthcare because sometimes it is necessary to mention which bad is avoided by using the product. So sometimes simply mentioning which good you would get does not always do justice to what the product can do for you. So the key learning here to address this dilemma here is really to avoid as much as possible the really scary and negative terms. And even if you have to mention something negative, for instance like side effects, always try to give it a positive spin.
To conclude, building a strong communication strategy requires two elements. First, you need to investigate who your target audience is, but also understand how they think and feel in order to be able to develop a communication that will be relevant to them by focusing on the main triggers, while on the other hand addressing potential barriers. And second, there are some simple rules which can help you develop a stronger message. And most of these rules may seem to you very logical or very obvious, but when we receive the materials from our clients, we actually keep on observing these same mistakes over and over again. Now, we are reaching the end of our presentation. We hope that you find it useful and that it raised some interesting questions on your side. You can actually begreep that you already received some questions.
Yes, we received several interesting questions. Let me start with this one. The EFSA regulations on health claims in Europe have a huge impact on what we are allowed to say in our communication. Do your findings take into account these limitations?
Yeah, that's a very good point. Yeah, of course, we are aware of the EFSA regulation, and it has a drastic impact on what you're allowed to say, basically. But basically, yeah, our golden rules, of course, apply still. In the examples that we show today, they are like examples that we made up in order to show our points. But basically, even for this message that are under EFSA regulations, we encourage our clients to really stick as much as possible to this, to these learnings. So what we mean here is that it's not always possible to phrase it exactly the way consumers or healthcare professionals would like to hear it, but yeah, so it's still good to keep in mind these main rules and try to get as close as possible when rephrasing your communication. I hope it answers this question.
Yes, Benoît, thank you. I think this is clear. There's another person who wonders whether these golden rules also apply to other product categories, so not necessarily healthy food products. Could you give your opinion on this?
Yes, like Benoît said in the beginning, actually the golden rules are not only based upon studies and communication studies we conducted in the healthy food and clinical nutrition area, but we also conducted these studies in FMCG, consumer durable area, and also in the healthcare industry. And what you see is actually that you see the same kind of lessons coming back throughout all the different industries. And of course there are little things that are different. There are also little things different between healthcare professionals and patients. So there are differences between consumer and healthcare professionals and patients. But in general you see the same kind of rules coming up over and over again. So yes, it is applicable in other industries as well. If you want, you can download from our website also a paper in which we do have the results presented over there of winning communication in the consumer markets.
Okay, thank you. That's good to know. We will make sure to include this information also in the email that you will all receive after this webinar, because we are reaching the end of this webinar, I see. So thank you for your attendance. I hope you enjoyed it as much as I did. Like I said, we will send all of you an email tomorrow with a link to our website.